From St. Louis Public Radio. This is the Politically Speaking Hour on St. Louis on the Air. I'm Jason Rosenbaum. Later in the hour, we'll talk with Department of Social Services Director Jessica Bax about her first year leading one of the most important agencies in Missouri state government. And we'll learn what the department is doing to retain people who conduct child abuse and neglect investigations. But first, Missouri lawmakers returned to Jefferson City this week to kick off the 2026 legislative session.
The Senate will be in order. Will everyone in the Senate, in the galleries, please rise?
And to be honest, what transpired in the House and Senate on Wednesday was tame. Lawmakers did not take to the floor and engage in unforgettable oratory. Nobody made a surprise challenge to either chamber's leaders. Lawmakers gavelled into session, passed some boilerplate resolutions to ensure they could keep meeting, and adjourned. Still, I wouldn't say the day was devoid of thought-provoking sentiments, especially when Senate President Pro Tem Cindy O'Laughlin of Shelbina posed these questions to her colleagues about the months ahead.
We also need to think of the next generation. For children born this year and beyond, what will they inherit? Will they inherit a state government that supports their health and safety? Will it create hope and opportunity, no matter their status, their zip code, the school they attend, or whether their families can give them the love and support they need?
O'Laughlin is likely alluding to how lawmakers could take up significant policy proposals this session, like getting rid of the state's income tax or expanding Missouri's school voucher program. But whether either of these proposals come to fruition may very well hinge on whether O'Laughlin and other Republican senators can keep their chamber functional. That's because Senate Democrats, like State Senator Carla May of St. Louis, are still thinking about what happened over the 2025 legislative session.
There's still some accountability that has to take place for the desolation of the Senate that occurred, before. And so those are the things that we have to address, and I think that we'll be able to address them and negotiate.
The Missouri Senate is unique because members can talk as long as they want on anything, as long as they can remain standing or until a majority vote to cut off debate. Last year, Senate Republicans quashed Democratic filibusters to approve measures targeting voter-approved abortion rights and paid sick leave initiatives. They also forced votes on a new congressional map and a plan to make it much harder to pass constitutional amendments. Cutting off debate in the Missouri Senate is considered highly unusual. And as Senator Brian Williams of University City explained, using what's known as the previous question to end debate often provokes retaliation from his fellow Democrats. That could include forcing the chamber to take a long time to do routine things like approving the Senate Journal or filibustering non-controversial bills. Those moves could have the effect of running out the clock on the session.
Democrats don't have short-term memory. We remember very clearly that the Senate broke down and we lost focus of what we should be focused on, and that's a functioning Senate. So I think there's a lot of important issues to Missourians that's been left on the table, and Democrats want to make sure that we prioritize that, but it needs to be done with dignity and respect by the Republican Party.
One of the big reasons why those foreboding statements from Williams and May could matter in 2026 is some of the policy proposals I mentioned earlier, like getting rid of the state income tax, are not universally popular among legislative Republicans. GOP State Representative Colin Wallenkamp of St. Charles County told me that he wants to make sure any income tax elimination plan doesn't make it impossible for the state government to do basic things.
I'm all for taking that burden off of the Missouri resident, but it really depends on the proposal to replace that revenue. I don't want to be without fire services, police. I don't want to be without roads, bridges, and functioning utilities. I don't want to be without good schools. So these are all things that we have to continue to pay for, and I think people want to continue to have those things. It just depends on how we replace these revenue streams and where are we transferring the financial burden.
Let's not forget that 2026 is an election year, where among the most high-profile campaigns include state Senate races where winning the August primary is tantamount to election. Democratic State Representative Carrie Engel, who is running for a highly competitive Jackson County-based Senate seat, says she expects political posturing to be at the forefront of the session instead of sober policy discussions.
I think that the Republicans are going to do anything and everything they can to distract from absolutely failing at economic relief for citizens, that to distract from everything that's happening in the national media and in Washington, D.C., to try to distract from all of the public polling that shows that they are upside down on every single issue of public importance. And they're going to try to drive us into the failed Brownback experiment in Kansas, obviously.
Engel, by the way, was referring to how Kansas Republicans under Governor Sam Brownback cut taxes so much in the 2010s that the GOP-controlled legislature actually had to backtrack to prevent the state from going off a fiscal cliff. Republicans like State Representative Tricia Burns are not as doomerish about the upcoming session, even with procedural morass in the Senate and election year politics casting a long shadow.
When we have low expectations, we deliver on a low level. And we're here to do things for Missouri.
Republican Senator Jason Bean says that he attended a dinner earlier this month that included his Democratic colleagues. And, at least for now, the two parties seem to be getting along okay.
You know what? Remember, I'm a farmer. So how many times do I go into a farming year where prices are down, weather looks bad, you've got a lot of stuff that looks to be against you? But you know what, as a farmer, I go into it with a positive attitude. And I think that's how that we're all going into this session. You know, there's a lot of things that we're talking about, whether it be what happened in last session, what happened in the budget. But I think we're all going into it with a positive outlook to say we're going to still do our job as senators and lawmakers and move the state forward.
Even with Democrats' ability to affect the trajectory of the Senate, they are still severely outnumbered in both chambers and only matter in the legislative process when the GOP majority is divided on an issue. House Minority Leader Ashley Awney of Kansas City says she hopes that changes this year when voters go to the polls.
As a minority party, we know our ideas for affordability will make little headway with the majority party hell-bent on comforting the comfortable and afflicting the afflicted, especially when they're trying to out-crazy each other with Republican primaries this year. But House Democrats will make the case for why a change in political direction is needed. After 2 decades of Republican legislative rule, working families can't endure much more.
And joining us from beautiful mid-Missouri to talk more about the beginning of the 2026 session is Sarah Kellogg, STLPR's State House and Politics reporter. Sarah, welcome back to the Politically Speaking Hour on St. Louis on the Air, and happy start of the 2026 Missouri General Assembly session.
Thanks for having me on the show, Jason. Excited for a new year.
Before we talk about the prospects for this session, what do you think about the possibility that House Minority Leader Awney alluded to in the clip you heard, that Democrats could end up breaking the GOP supermajority this year?
I do think that is possible. Democrats only need to flip 3 seats in the House and 2 seats in the Senate for that to break those supermajorities. And back in 2024, basically Democrats gained a seat and lost a seat, so it's pretty much the same. Which in a year where really it felt like everything shifted right, that felt very notable. And so in a year that's probably likely bad for Republicans, I think Democrats have a pretty good shot at breaking the supermajorities.
So Sarah and I cannot predict the future. I wish we could, because we would be multi-billionaires by betting on sports, like Back to the Future 2. But there could be some event that makes the legislature buckle down and work together, and our expectations about a non-productive session are proven wrong. But is it rational for people to be skeptical that anything other than the budget and some non-controversial bills will get done this year based off everything that happened in 2025?
I mean, that's a really good question. I think it remains to be seen. A lot of the priorities that Governor Kehoe wanted actually were accomplished last year, and we'll see what ends up happening with this potential income tax elimination. But I think that ultimately, yeah, I do think it'll be less productive, probably just because there aren't as many big ticket items that Republicans want to get done. And we'll see what Democrats, what their priorities are, that they can kind of align themselves with Republicans. But I wouldn't be surprised if it's a little less productive than last year.
And are there any issues that could produce bipartisan consensus?
I think that property taxes is one area for sure. I know that when Leader Ani was speaking to the media on Wednesday, she said when she was knocking on doors, she didn't hear anything about income taxes, but she sure did hear things about actually property taxes. And Speaker Patterson created an interim committee to study that. And I think you can talk to Democrats and they can say there's definitely something that maybe needs to be done. Now, what that is, I don't know, but there is a possibility, I think, for bipartisanship there. And I think there's always a lot of cooperation ultimately when it comes to the budget.
When Governor Mike Kehoe does his State of the State speech next week, he's widely expected to talk about what you alluded to, his plan to phase out or eliminate the state's income tax. What are you hearing from legislators about that plan?
I'm not hearing a lot because I think everyone's trying to keep it pretty mum. I know Majority Floor Leader Senator Tony Luetkemeyer said pretty much as much yesterday during the Senate press conferences. So I think there's a lot of just anticipation of what that's going to be. From what was alluded, it feels like it's going to be a gradual plan versus something that's outright. But there's also a lot of concern from Democrats that it's going to be a shift, really, instead of elimination, from shifting from income taxes to sales taxes, which obviously would affect everyone, and sales taxes would likely have to be increased. So I think there's a lot of opinions and thoughts going on right now, but we won't know for sure until Kehoe reveals that plan on Tuesday.
We may not be able to predict the future, but Sarah did read my mind because I spoke with State Representative Tricia Burns of St. Charles County, and she also does not expect Kehoe's plan to end the income tax right away.
The responsible approach would be to phase it out over time, and that's actually what is happening. So most people think we're just going to go and yank all the circuits out of the board, and that's not the case. I, too, want a functioning government. I want services like great schools and police. We still need to cut the bulk of the waste out.
That was Republican State Representative Tricia Burns of St. Charles County talking about her expectations about Kehoe's plan to axe Missouri's income tax. So I guess this was the question I was bringing to people like Representative Burns. My mom lives in Florida. There's no income tax there, and that's great. But as we were discussing interpersonally, Florida has Disney World. Texas has oil. Tennessee has Dolly Parton. How can Missouri get rid of the income tax without it not having any money left over to do anything that state government needs to do?
I mean, I think that's a question we need to be directing to those who want to eliminate the income tax or reduce it. I don't really know the answer to that, and I'm curious to see what the plan is, because if it is a shift to taxes on sales tax or even services, that's going to affect Missourians at a time where I think affordability is a really big issue and day-to-day prices and costs. And so I think, that's a great question, Jason. I wish I had the answer for it.
This discussion about ending the state income tax comes as Missouri's budget situation is just not as good as it was when the federal government was shipping billions of dollars here in the wake of the COVID-19 pandemic. How is that reality going to affect any plan to end the income tax?
I mean, I think there's going to be skepticism then if there are calls for a smaller budget because there isn't as much revenue. And I think the retort then is going to be, well, then why are we putting ourselves in a situation where that might be smaller if there isn't a one-to-one replacement of that elimination? So I think there's going to be kind of, like a skepticism, I think, of people being like, well, then if we can't afford this, then why can we afford this? So I think it'll make some of those budget ideas a little harder to swallow but I don't think there's a disagreement that it is a tighter budget, mainly because a lot of those federal dollars that were allocated have been spent or are allocated. But I think that the question is going to be really, really small. I think there's going to be questions about that.
You mentioned property taxes earlier as something that you think could have bipartisan consensus. And at a Senate press conference yesterday, Senate Minority Leader Doug Beck of Afton talked about why St. Louis County lawmakers are going to be watching the debate over property taxes very carefully.
We probably pay more in property taxes than quite a few other places in the state do. State does, right? We have we have a system where agricultural land is valued at 30%, and they don't pay near the amount of property taxes that people in my district pay. People go to the polls, they vote for tax increases on their property taxes to support their schools, their fire departments, and things of that nature. If you ask people, do they want an ambulance to come at their house in 7 minutes instead of 2 minutes? Those are all things you need to ask. Do we need to be making that decision here at the state level? I'm sure we're going to have that debate.
That was Senate Minority Leader Doug Beck, a Democrat from Afton. Sarah, property taxes are a subject that many people have very strong opinions about, and they feel like they're paying too much of. But given the waterfall effect of making big changes to it could decimate local governments, is this just too complicated and thorny of an issue to actually, for the legislature to actually accomplish anything with?
I think it might be too complicated to accomplish both an income tax reduction and a property tax reduction. I think it's going to be likely one or the other. That's something that's the sentiment is shared by Minority Leader Ani. I spoke to her about that, and she's just not sure if there's kind of enough bandwidth to tackle both of these issues. But I will say, when speaking to the press yesterday, Senator Luke DeMeyer, the majority floor leader, mentioned property taxes first when it came to priorities. And he said that was something that all of the caucus, the Republican caucus, cared about. So actually, I think if there were to be one, I think it may be a bigger likelihood that it would be property taxes. But I do think that both issues are very large and complicated, are going to take just a huge amount of effort to get finished.
We've talked a lot about taxes in this conversation, and I want to move on slightly to tax credits because State Treasurer Vivek Malik has said he wants to expand Missouri's school voucher program or scholarship tax credit program. And that received a $50 million infusion in state funds last year. He wants to increase that to $100 million for a program that funds scholarships that could be used to pay for private schools. What are the prospects for this idea, especially because this is not a program that is universally beloved among Republicans?
No, and also it's in court right now because there's concerns that that's not constitutional to use public dollars to ultimately fund private schools. I think that this is going to be a controversial ask. I think if Treasurer Malik asked for just another $50 million, I think that maybe would have gone over a little better, and that's probably the floor. That's what Senator Luke DeMeyer spoke to me about, that it's likely the floor of that would be $50 million, but $100 million I think is a little tougher to swallow just because it is going to be a smaller budget year, and I don't know if that's going to be something that's prioritized.
So if I had to ask myself about my expectations for the 2026 session, which would be strange because why would I ask myself what I think? I could just think it. I obviously am a very thoughtful person. I would probably say be more on the doomerish side, just because 2025, as you mentioned, was so productive that there just aren't as many things that absolutely need to be accomplished in 2026 from a policy level or even from like a political standpoint. The one example that comes to mind is I thought the measure to try and overturn the abortion initiative from 2024 was going to be put on the ballot this year, but it was put on last year. So how do you think that reality could affect how the session goes?
I mean, I've joked with our editor, Jason, that I just think I had a very boring opening session feature because I do think it's mainly going to be the budget and these tax issues. I do think a lot of what Kehoe wanted was accomplished. Something kind of to look out for. I don't expect huge fireworks, but I will say that the police board that the St. Louis Police Department is now under control, their appointments are actually going to be in the Senate this year, so that's something I'm keeping an eye on. But as far as other big issues, I think we're going to get into kind of weirder niche issues that maybe wouldn't have been done if some of these big-ticket items hadn't been accomplished last year, or at least on their way to the voters, not necessarily passed.
But as State Representative Carrie Engel of Jackson County mentioned earlier, 2026 is a dreaded election year, or if you like elections, a blessed election year. And it's an unusual situation where the only statewide race on the ballot is auditor, meaning state Senate primaries will probably get a lot more attention and focus. How do you think that could affect how the session proceeds, especially in the House where some of the House members are running against each other?
I do think there'll be bills that are heard that maybe won't get farther than the House, and that's been to broad attention. But it also, you have to wonder the temperature of the election itself, where this is going to be an election year that historically would favor Democrats over Republicans. So then you have to wonder, well, are they going to bring attention to issues that maybe won't be as popular? What are they going to champion that would, give them a leg up over maybe a fellow lawmaker? So I'm curious to see how this particular election year session handles out, because I do think it'll be a little different than it would have been in 24 or even 22.
Sarah Kellogg is St. Louis Public Radio State House and Politics reporter. Sarah, thank you as always.
Thank you, Jason.
And Sarah and I will be part of St. Louis Public Radio's coverage of Governor Mike Kehoe's State of the State speech. You can listen to the governor's address and analysis from STLPR's political team at 3 p.m. Tuesday on St. Louis Public Radio. We need to take a quick break, but when we return, we'll talk with Department of Social Services Director Jessica Bax about her first year on the job. This is the Politically Speaking Hour on St. Louis on the Air. Welcome back to the Politically Speaking Hour on St. Louis on the Air. I'm Jason Rosenbaum. It's been about a year since Governor Mike Kehoe selected Jessica Bax as the director of the Department of Social Services. And to call the agency important and challenging would be an understatement. Bax is in charge of overseeing Missouri's Medicaid program, the Supplemental Nutrition Assistance Program, or SNAP, and the Temporary Assistance for Needy Families program, or TANF. Her agency also includes Missouri's Children's Division, which manages the state's foster care system and investigates suspected child abuse and neglect. Bax says that she was well prepared to lead the huge agency, especially after she served in key roles in other Missouri state departments.
You have to have the mindset that behind every decision that you make is a child, a real person in Missouri, and how does that affect them? How does that ultimately impact the programs in a positive way?
But the long-term challenges before Bax are difficult even for the most seasoned state employee. That's especially the case after Congress passed what's known as the Big Beautiful Bill that enacted seismic changes to social services programs. A little later in the show, we'll hear her thoughts on the future of Missouri's Children's Division. But Bax and I first discussed how the Big Beautiful Bill affects Medicaid, the health care program for low-income, elderly, and disabled Missourians. That comes after Missouri's longtime Medicaid director, Todd Richardson, left his post late last year. Josh Moore is now in that role. I talked with Jessica Bax in her office in Jefferson City earlier this week. So the changes that I was alluding to earlier are kind of on two prongs. The first is the implementation of work requirements. And I think they have to actually be in place by the end of this year unless the state gets a waiver. Is that correct before I ask my question? Okay. I think there's a lot of questions about whether states have the infrastructure or technological backbone to actually implement an oversight system to see if somebody is following the work requirements that are laid out in the One Big Beautiful Bill. When I was talking with Todd Richardson last year, he seemed pretty confident that the state would be able to do that. Are you also confident that you're going to be able to actually roll these work requirements out by January 2027?
I'm confident that we are. There's a couple of things that we were already working towards in terms of, and so just to kind of level set, you said it's a very large, complicated agency. This is a great example of that because Todd Richardson, Josh Moore, Medicaid director, Medicaid eligibility falls within our family support division. So the implementation of work requirements and all of the technology with it is really within our family support division. So one of the things that I knew coming into the agency and understanding, getting a deeper understanding than I had even working with the agency over the past, but was that the the technology needs for Medicaid were really, really needed a lot of support. So we brought in a Department of Social Services CIO, and she has really been looking at, from the beginning, Family Support Division as her kind of number one priority. And that even increased more with HR1 because we knew we had to streamline and get more automated. And work requirements is at its core level income verification, income and hours. And so that's really the path that we were already on with technology. She's looked at the states that have done it successfully and the states that have failed, and kind of what lessons did we learn from them and the challenges that they had. And so I think we have a really good positive path.
One of the things that Richardson talked about that actually seemed pretty innovative and potentially exciting was the possibility for the state to determine somebody's work requirement eligibility or income verification without them actually having to do anything through like payroll records or something like that. And there was a lot of criticism of the work requirements from people kind of on the left end of the spectrum because they saw it as kind of a paperwork trap that would kick people off of Medicaid that were entitled to it. But that sort of way of verifying income kind of solves that problem. So my question is that going to be the way that this happens? Because if it is, it could be very seamless and painless for people who are already on Medicaid.
Yeah. So Todd was correct. The path that we're working on is an automated, for as many people as possible, an automation of those requirements where we are able to verify through our data sources. We kind of have a, not to get too nerdy, but a waterfall of verification sources
or
that we go through.
Or a cornucopia of data services.
You check this one first and this one. We start with the free sources and then we move on to the paid sources of information. And I think that's really where we may only need to verify if someone perhaps has multiple jobs, is doing work for cash, is doing maybe gig work. Those are the types of things where we've also, though, brought in a solution through our partners at Steady IQ. And that has been a really great relationship. We're working with them on the path for work requirements within their platform as well, to make sure that we're ready for individuals who maybe don't have a 40-hour-a-week job, or they have multiple jobs and they need a solution in that more suits them.
The other thing that's on the horizon is the whole concept of Medicaid funding. And there's a couple of different ways we can go here. The first is from, again, talking with Todd Richardson, the money that the state got from the federal government from the American Rescue Plan that essentially gave the state, I guess, $1 or $2 billion for expanding Medicaid during that period of time, I think is going to run out in the next couple of years. And the state is going to have to find money for the state match, which I'm not sure how much it is, but my guess would be between $200 and $300 million a year, maybe more. How many more years does Missouri have until they reach that point where they're going to have to not rely on that money anymore?
I think that we're reaching that point within the next 2 years. And so that's something that we've had candid conversations about. And I think that the other piece of that is just in general, the growth of the Medicaid program is really something that we're looking at from a healthcare management perspective. And how does Missouri move towards a structure where we are helping people have good health outcomes and lowering our overall healthcare cost for the program while sustaining it for those who qualify.
And one of the things that I guess is better news in terms of money is another part of the big, beautiful bill is the Rural Healthcare Transformation Plan. Missouri recently got awarded $260 million. That's from a $50 billion outlay in total. Missouri received the 9th most money out of any state, but less than Kansas and Oklahoma. Why did we lose? Why did we get less than Kansas and Oklahoma, two states that, admittingly, I have familial ties to? My mom lived in Overland Park for a while. My grandma's from Ponca City, Oklahoma, so I do like those states. But is it just because they had more rural populations than Missouri? Is there some?
There's a couple of different. If I will tell you, there was a scoring algorithm.
I was going to guess that, but I wanted to just make sure that was the case. But continue.
Yeah, absolutely. So I would like to know as well. No, the scoring was done for the funding from each state. Each state had a base of $100 million each. If they, qualified and wrote an appropriate application that CMS approved, and that is, so your baseline funding is $100 million a year. From that, the other kind of pot of money, if you will, was competitive amongst the states. And it was based on your level of rurality. And so that took into account your rural population, but also how isolated is that rural population. You really saw Alaska being way up. I think they might have been number 2 in funding. And so really more about healthcare access related to how rural you are.
Is this a one-time money, or is it going to be like $216 million or more for a number of years?
This is $216 million over a period every year for 5 years.
Okay.
And so, but with that, we are seeing some of the new types of requirements that are coming from the federal government, in that performance and outcomes and reaching your, objectives within your plan year by year are going to determine the amount of funding that may be redistributed amongst states.
So it could be potentially up to $800 or $900 million over that 5-year period, but only if you actually achieve the goals in there.
Correct. And on an even more positive note, if you keep doing well and other states aren't doing as well, we can take Kansas and Oklahoma's money.
Oh, that would be amazing. I use the city of Doniphan as a great example, not only because my good friend Caroline Dohack is from there, but I've been to Doniphan, and that is a place that used to have a hospital that no longer has one, and healthcare is not as present as it was there 10, 20 years ago, causing people to say, move to Poplar Bluff or move to Cape Girardeau where there are hospitals. So how would this money help cities like Doniphan or others that don't have as robust access to healthcare that they did 10, 20 years ago?
Missouri has had close to a dozen hospitals close over the past recent history. And being from a rural area myself, I grew up in, most people won't know it, it's Drake, Missouri. And I was born in a hospital in Washington, Missouri, which is an hour away. And that was the closest hospital. So I think that when we're thinking about health outcomes, you really can't compare one. Rural is rural, but rural areas have very different unique needs, very different unique health systems, and how those health systems work together. So what's great about the Missouri Rural Health Transformation Plan is that it's really built on a local, kind of a hub and spoke model of local communities having the ability to identify what are their needs in order to make improvements, and how do they better serve the individuals within their communities and get better health care outcomes. So what partners in their local community do they need to work with for doing nutrition education that might go along with a GLP-1 for weight loss and, physical activity, those things that healthcare may not pay for, but when we see healthcare start to pay for them, we can demonstrate the value that it brings in lowering the overall cost of healthcare. We can get people back to work and being productive and healthy in their lives. And that's really the impetus of this. And when I talked about earlier, moving to alternative payment arrangements in Medicaid, rural health transformation funding, you see the backbone of Missouri transitioning to value-based payment for our healthcare providers within the plan. There's the digital infrastructure as well as the actual building of the payments.
And I think that the other thing, and this is a broader criticism of the Rural Transformation Fund, is that, yes, it's good and nobody's criticizing it, but it was kind of brought in as kind of this compromise because the medical provider tax is going to be cut potentially in the future. So how do you make sure that this money is maximized when a whole bunch of other money going into Medicaid could potentially be cut in the future if Congress doesn't reverse those medical provider tax cuts? I understand a lot of hypotheticals and what ifs there, but I feel like that has been the major criticism
I
of
think
this
it's a
fund.
very, a question a lot of people have. So I'm glad that you asked it. I think with the Big Beautiful Bill, a lot of the reporting and the media coverage, particularly on the Rural Hospital Fund, was early on in this becoming like a negotiation point, and then there wasn't a lot of reporting after the final bill passed about what that specific language was that was finalized by Congress in the bill. And when you look at that specific language, it really is not it's not the same message that was originally kind of what you talked about, replacing a loss for healthcare providers because of a potential future tax cut.
That was Department of Social Services Director Jessica Bax talking about her first year on the job. We need to take a quick break, but when we return, we'll discuss how Bax is taking on the challenge of overhauling the state's Children's Division. This is the Politically Speaking Hour on St. Louis on the Air. Welcome back to the Politically Speaking Hour on St. Louis on the Air. I'm Jason Rosenbaum. As mentioned before the break, the Department of Social Services is responsible for overseeing Missouri's Medicaid program, as well as SNAP and TANF benefits. But it's also in charge of Missouri's Children's Division, which, among other things, manages the state's foster care system and investigates child abuse and neglect. Over the past several years, St. Louis Public Radio reported on a host of alarming problems within the agency. That includes huge unfinished case backlogs, as well as turnover and recruitment struggles in St. Louis. And in some cases, Children's Division personnel failed to prevent fatalities, including when children ingested fentanyl from their parents. In this part of my conversation with Department of Social Services Director Jessica Bax, recorded in her office earlier this week, we discussed how she and Children's Division Director Sarah Smith are trying to keep the agency on track. And she also talked about how she's addressing something that many child welfare advocates believe as the center of the Children's Division's chronic problems: salaries that are too low to recruit or retain investigators tasked with keeping kids safe. What has DSS done to make this agency function better? I'm not maligning the people that work at Children's Division. They have the hardest job in state government. And as we'll talk about, I think they're often doing this job for pay that is not competitive. But it is pretty clear that Children's Division has not been working for the past few years. And I feel like that is like your biggest challenge as DSS director, is to make this a trusted, functional agency again. Understand that's a general question. We'll drill into more specifics in a second, but I want you to address that.
You're right. There's a lot of challenges and serious issues, things that keep you up at night about Children's Division. And coming into the role, talking with Governor Kehoe about understanding the pain points within Children's Division, and really, how do you approach that? Because it is a very large function that has a very just vital impact, the safety of Missouri's children. So one of the things that I first needed to do was find someone who truly understood child welfare. I have a lot of experience in working through government and how to apply that, but I really needed Sarah to come in and bring her perspective. So identifying where do staff need support, because you've got to kind of get to that root cause analysis again of where's the breakdown? And when you have a high turnover, part of it's salary, but you've got to think what's in your control. And nobody's going there to get rich and taking that job to get rich. So how do we make sure they feel supported in their role? And that's why we've been focusing on things like we had a manual that is, I would say, was more philosophical than practical. So working over the past year to turn that into practical guidance that staff understand kind of step by step how to do a risk assessment, where to turn to for questions. That's in motion. We're working on enhanced training. We've acquired some great technology that is basically virtual reality goggles that allow staff to, when they're new, experience the different scenarios that you might encounter as a children's division worker and kind of practice and work through those. And then one of the other things that I think has been really important is how much Sarah and her leadership team have been out to, I think they've been to every circuit at this point, because child welfare is a system. It's not just children's division. It is the court system. It is the juvenile office system. It is law enforcement. It is all of the providers within the network. And so it's the foster families. So one of the things that they needed to do was go visit in person and understand where is the breakdown here locally, because there are systemic issues, but there are also issues that are maybe more locally driven.
Well, here's one of the biggest systemic philosophical things I've encountered. And it kind of goes in with training, but it also is about philosophy. So whenever I write about children's division, I often get messages from just ordinary people from two wildly different perspectives. The first is from parents who've had children placed in foster care. They sincerely believe children's division was wrong in removing their kids, and they think the system is too strict. And the other perspective is from advocates and parents who know abuse or neglect is going on, but staffing levels for investigators is just too low, or investigators missed obvious signs. That is an extraordinarily difficult needle to thread between being fair to people that may be dealing with poverty and not intentional neglect or abuse, and people who are abusing or neglecting their kids and getting away with it. How do you thread that needle?
I think if you look around the nation, you would see the exact same dichotomy of responses to child welfare within those states. And when you're approaching those decisions, it is oftentimes when we go into a home, there is a level of training about what are you looking at, but are you making sure to kind of check all of the boxes? Did you maybe call collateral contacts and find out more about who's in this child's life? But what's a risk and what's an actual safety threat, and what's a risk that can be managed? A lot of times, how we can manage risk and help provide support and resources for families for a child to be safe is dependent upon local resources or statewide program resources that aren't available, that are larger programs. They're larger problems than children's division itself. Housing, mental health, those are things where if those supports aren't in place, sometimes, so we're really working with our team members to understand that mitigating risk, you may have a plan, but if the resources aren't there for that plan, you have to, really come up with a different plan.
You mentioned pay. And I know that you cannot just wave a magic wand and pay all of your employees more money. That is the responsibility of the legislature and to some extent the governor. I asked Governor Kehoe about increasing the starting pay for child abuse investigators, which for context, for starting salary, it's around $45,000, $46,000. If you've been here longer, you obviously make more. And the problem with that is, you're right, you're not meant to... Child abuse investigators don't do that to get rich, but $45,000 is not competitive with Illinois. Illinois makes a starting salary $71,000. And there are other private sector jobs which pay a lot more. And I think that's responsible for the high turnover because this is an extraordinarily difficult job that can be very traumatic for people. And if people have another opportunity to go somewhere else to make more money for less trauma or, whatever.
Not 24 hours on call, all of
Right.
those things.
So I asked him that, and he said that, we should see some action on that pretty quickly. That was in May. It's January. I wanted to give some time to pass before talking with you. I am interested about what, if anything, you're going to do on that, or what you can do without the legislature specifically giving you more money to raise that starting salary.
Yeah. The time of service pay that happened was really, really critical for our team members. And for context, the time of service is retention pay plan that was recommended by the governor, passed by the legislature. And you mentioned in your comments that, if you've been here longer, you make more. That wasn't true before this, because there was a 17-year period, I believe, with no cost of living increases for state employees. And so you had someone who had been here almost 20 years who was making as much as someone who walked in on day one.
Yeah, and just again, not to interrupt, when I say 45,000 and I say how low it is, the other context is 5, 6, 7 years ago, the starting salary was $34,000 or $35,000. So it has gone up, and I don't want to say that hasn't been significant, but continue.
Yeah, no, huge investment from the legislature and from Governor Parson in the state workforce, and then continued by Governor Kehoe. And he really kind of took it to that next step of a pain point with the increases was there wasn't any incentive to stay and become an experienced worker who could mentor your fellow workers. And so that added to being a tough job. So some of the things that we're looking at doing is how can, without a specific dollar increase from the General Assembly, is thinking about the work in terms of what are some elevated roles that are really necessary within Children's Division to help out the frontline worker. So do you need frontline workers to have an extremely low caseload to be successful, or can that caseload be just a little bit more on average if they had a consultation team who had a lot of experience in maybe children with complex medical conditions, or children who, unique safety situations, drug use. And so if they had an on-call expert, I really think, and those are jobs that, would become a career ladder and really incentivize someone to stay.
Yeah, that's what I was going to say. That seems to be like a good solution instead of waiting for the legislature. So you start out as starting salary of $46,000. You work there a couple years. You get promoted to one of these consultation that's very specific, and maybe you get 57, 58. I'm just throwing out these numbers. That becomes the incentive for people to stay and keep doing the job and getting paid more money.
Absolutely.
Not as much as the private sector,
No.
but that seems to be like a functional thing that could really hit at that problem. How soon do you think that can be implemented? Is that being implemented now?
That's being implemented now.
That was Jessica Bax, the director of the Missouri Department of Social Services, talking with me earlier this week in her office in Jefferson City.
The Politically Speaking Hour on St. Louis on the Air is produced by Jason Rosenbaum, Alex Hoyer, Emily Woodbury, Danny Wysentowski, Maya Norfleet, and Elaine Cha. Audio engineering and sound design by Aaron Dorr. The politics editor is Fred Ehrlich.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thanks.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.